Why is your child constipated? Hi, I'm Dr. Batool, a family doctor, and if your child is struggling to have a bowel movement, here's something important to know. Constipation in children is often not simply because they don't have enough or eat enough fiber. One of the biggest causes is actually withholding their bowel movement. It can start after a painful or hard bowel movement. The child thinks that hurts, I don't want to do that again. So they start holding it. The longer they hold it, the more water gets absorbed from the stool, making it even harder and more painful to pass. And then they can get stuck in the cycle. They go to the bathroom, it's painful, withholding, harder stool, more pain. Other common causes include not drinking enough fluids, a diet low in fiber, not eating enough fruits and vegetables, changes in routine, toilet training, starting childcare or school, and sometimes changes in child's environment. And sometimes medications or an underlying medical condition can also contribute. So what can you do as a parent? First, encourage regular toilet training. So that is having your child sit on the toilet for about 5 minutes after meals without pressure or punishment, and making sure their feet are supported on a footstool so their knees are slightly higher than their hips. This can make it much more easier to have a bowel movement. Encourage plenty of fluids and fiber-rich foods like fruits, vegetables, whole grains. And most importantly, don't punish your child for accident or withholding. If constipation has been going on for a while, diet and water alone may not be enough. Your doctor may recommend stool softeners medications, often for several weeks or longer, depending on the situation. And if your child has severe abdominal pain, vomiting, blood in their stools, bowel growth, or constipation that has been persistent or severe, they should be assessed by a doctor. Remember, a child who is withholding isn't being difficult. They may be scared because they have learned that having a bowel movement hurts. Breaking that pain withholding cycle is often the key to getting them feel better.